Prior to the founding of the National-Alopecia-Areata-Foundation, no organization existed to help people with this common autoimmune disease. It took a visionary young college student with alopecia areata to approach a leading dermatologist. Together they formed NAF in November 1981. The three pillars of NAF's mission are awareness, support, and research. Greater awareness promotes greater support, and greater support provides a larger pool of willing patients from which to draw volunteers for clinical trials. Our three-pronged approach serves a single vision: to find treatments and a cure for alopecia areata while improving quality of life for those who have it. NAF has funded, and continues to fund, numerous research grants whose viability and potential we consider groundbreaking. And so does the National Institutes of Health. For every $100,000 NAF has spent in research funding, NIH has spent another $1 million on continuation grants. That's a tenfold return on our investment dollar. And NAF has a robust awareness program and network of support volunteers throughout the country and around the world. This means we bring in more people with alopecia areata who can benefit from and participate in the treatment development program. We seize every opportunity to advance our mission, whether it's in the laboratory, state house, or your own neighborhood. NAF conducts strategic planning and accomplishes the goals set forth. We're one of the rare organizations that can say that. This is due primarily to a small but cohesive and professional staff providing maximum results with minimum expense. NAF doesn't have to spend a lot to do a lot. NAF's success metrics are as impressive as they are easy to track. Just look at how many of the researchers to whom NAF provides grants go on to receive larger funding, or how many people with alopecia areata we've had register for our biobank and clinical trials network. But if one wants real human metrics, they need only attend our annual patient conferences designed to serve the thousands of people we help every day, along with their families. This is a measure of success of which we are the most proud. NAF's guiding principle is to provide only the most accurate and up-to-date information on alopecia areata. There are misconceptions about alopecia areata, which we often clarify even to those who may have the disease. People often think alopecia and alopecia areata are one and the same. They're not. Alopecia simply means hair loss, and there are many types of hair loss. Alopecia areata is the only one that is an autoimmune disease. However, it's not contagious or fatal. Also, many don't realize all NAF has to offer: the school guide, the Pen Pal and Cyber Pal programs, the cosmetic guide, the Ascot Fund that provides money so people can purchase a hairpiece. I urge you to visit our website and see everything NAF makes available to the alopecia areata community. NAF has made possible tremendous strides in the research of alopecia areata through our treatment development program. We fund research projects around the world which we believe will hasten safe and affordable treatment and a cure for alopecia areata. NAF has also maintained the Alopecia Areata Registry, Biobank, and Clinical Trials Network, even after government funding ceased. These samples will speed clinical trials of potential alopecia areata treatments. Just as important, we've improved the lives of many thousands of people, from sending school guides and DVDs to help kids cope, to going to Capitol Hill to advocate for greater medical research funding. NAF is an internationally known organization with a well-founded reputation for being the source for accurate information about alopecia areata. But like all well-known organizations, we have to be on the lookout for those who would take advantage of our community. The internet has made it that much easier for non-viable organizations to spread misinformation. Worse, online charlatans promise miracle cures that often endanger patients. Thanks to our long-standing reputation and relationships with the scientific community, NAF knows what works and what doesn't. More money would allow NAF to engage in more venture philanthropy. We would invest even more in our treatment development program so we could better partner with industry and government to get viable treatments and get them faster. Money equals speed. The more we raise, the faster we'll be able to find a cure. Even the fastest pathway to an FDA-approved cure takes years and costs millions of dollars. We need significant and sustained donations to realize our goals. Insurance coverage continues to be a hurdle for the alopecia areata community. Those with the disease have a difficult time getting coverage for hair, prostheses, and/or treatment. Ironically, we're better equipped to take on the big federal issues because then we're only dealing with one set of laws. We have an alopecia areata legislative liaison program designed to do just that. The problem with insurance is that it's state regulated, with different laws applying to each state, and sometimes employer-based plans within the state. At this time, we just don't have the resources and the number of people necessary to fight that many individual battles. But with more help, we could.